Racism, oppression, and discrimination toward Black people underlies every institution in the United States, and it kills people. The healthcare system, by definition designed to promote wellness, is no exception. The most relevant example today is the COVID-19 pandemic, which has drawn attention to the inequalities in standards of care. A May 2020 study by Carrie Gross estimated that in the US, Black people were 3.57 times more likely to die from COVID-19 than white people. As someone who's going into the healthcare system myself, statistics like these are something I aim to change. Ladies and gentlemen, in the next few minutes, you will understand the pervasiveness of racial disparities in healthcare. First, I'll explain how implicit bias still occurs despite non-discriminatory training, and second, I'll explain that Black patients receive a lower standard of treatment than white patients. Healthcare professionals are taught the guiding principles of medical ethics, yet these values sometimes blur in practice. Autonomy, beneficence, non-maleficence, and justice are all meant to help improve patient care, and to train practitioners to be fair-minded. A study led by BMC Medical Ethics in 2017, however, concluded that physicians aren't special. Rather, their biases are consistent with those of the general population. These researchers are also cautioned that these biases are likely to affect diagnoses and care. As you'll learn in my second point, there is strong evidence to support this warning. Fortunately, the healthcare system recognizes these faults and has made efforts to combat them. For example, back in 2002, the Institute of Medicine recommended strengthening health plans so that minorities were not disproportionately denied access, and urged that more resources be directed towards enforcing civil rights laws. All of this was met with limited success. In 2017, the Agency for Healthcare Research released its report on healthcare quality and disparities as requested by the Institute of Medicine. This report found that while some aspects improved, many of the same issues remained. 40% of the quality measures were still worse for Blacks than whites. Implicit bias in the healthcare industry is not only limited to patient aspect. Stereotypes can negatively impact jobs and education in healthcare as well. For example, African American enrollment in medical school still lags. It is harder for doctors of color to move up in the workplace, and minorities are consistently paid less for the same hospital positions. Less than 6% of practicing US-based physicians are African American. This is a bit of a pitfall, since doctors of color would actually help the African American community overcome the historical mistrust of the medical system. The African American community has reason to mistrust the healthcare system, as its members are not treated equally. Out of a myriad of examples, the Tuskegee study of untreated syphilis in the African American conducted by the U.S. Public Health Service from 1932 to 1972 stands out for its blatant cruelty toward Black men. According to an article written in MedPage Today by Dr. Al Agba this year, 600 impoverished African American sharecroppers from Alabama were enrolled in a study with the purpose of observing the progression of untreated syphilis. Although penicillin became available as a treatment for syphilis in 1947, researchers continued to observe the men while intentionally withholding treatment. The men went blind, insane, or experienced severe complications, and by the time this study was terminated in 1972, 28 men had died from syphilis, 100 more had succumbed to complications of the disease, 40 spouses contracted the disease, and 19 children had been born with congenital syphilis. All these victims were African American. This is one way that African American voices are ignored in the medical world and effectively treated as less than human. A common theme here is that minorities are placed in situations where their health is risked, as their stressors from racism contribute to this decline in health. Yet another way that Black patients receive lower standards of care is in pain management and diagnoses. In 2020, Dr. Sabine from the AMC said that half of white medical trainees believe such myths as Black people have thicker skin or less sensitive nerve endings than white people. These false beliefs and stereotypes lead to treating Black patients' pain inappropriately and can also affect diagnoses, which can put the patient's life in danger. In that same article, Dr. Sabine mentioned a collection of studies that found that African American patients were 22% less likely than white patients to receive any pain medication. In addition, Dr. Biggers from Medical News Today noted that Black patients have higher blood pressure, lower rates of flu vaccinations, less access to health insurance, and most drastically, a lower life expectancy. Now, some may argue that these disparities are attributed to biological differences. However, the effects of bias in healthcare is much more evident. For example, an astounding gap exists between maternal and infant mortality rates of Black women and white men. Compared to their white counterparts, Black mothers are more likely to die from pregnancy-related causes. 3 times higher to be exact. Oftentimes, Black women have limited access to prenatal care as well as postpartum care. No biological evidence can be found to support this disproportionate mortality rate, yet it can be concluded that those same myths about Black patients affect how they are treated in a medical facility. Denial of pain or symptoms would certainly increase the risk of injury or death. In closing, I hope that you see how the facts show the pervasiveness of racial disparities in healthcare. I have explained the implicit bias prevalent among healthcare professionals and how that bias leads to unequal treatment of minority patients. Although I mainly spoke about these disparities in the context of African Americans, I want to reinforce the fact that they affect all minorities and people of color. The first step to improvement is admitting that there's a problem in the first place. The healthcare system, meant to heal and protect, is not immune to institutional racism. And now that you know that the issue is there, can you recognize it in yourself and others? What can you do to make sure these biases don't end someone's life? Thank you.